Hi everyone, today I'm going to be talking about my capstone experience in the care of a patient on the labor and delivery unit. So, the patient background was that my patient presented to the ER with a decreased level of consciousness along with very visible ascites and vaginal bleeding. Because of the amount of fluid in her abdomen, they performed a paracentesis, which was guided by an ultrasound, that also confirmed that she was pregnant. The patient stated she did not know she was pregnant and that she did not have any prenatal care. It was later determined she was at 26 weeks gestation. Along with no prenatal care, she tested positive for alcohol, marijuana, and methamphetamine in her system. Another ultrasound was ordered, which showed a complete placenta previa that would require C-section, and the fetus showed signs of fetal alcohol syndrome. She was then admitted to the ICU because of her level of consciousness. Along with her ascites, she has a history of cirrhosis, which is known as chronic liver damage from a variety of causes, which leads to the liver to scar and end up in liver failure. Some causes of liver failure include excessive alcohol consumption, obesity, or long-term hepatitis B or C infections. She had excessive alcohol consumption use, a history of it, and also a history of hepatitis with ascites. Her other history also includes GI bleed, hypokalemia, MRSA, alcohol withdrawal, depression, anxiety, preeclampsia, endometriosis, drug and alcohol abuse, thrombocytopenia, and sexual violence. So it is a very extensive list. Next, I'm going to talk about her assessment when she got onto the labor and delivery unit from the ICU. So for the most part, her vitals were within normal limits. Heart rate ranging from 70 to 100. Blood pressure was 115, 130 over 80s. Her respirations were around 14. Temperature, she was afebrile, and her SpO2 was 96 to 100% on room air. The only thing was that she complained of constant pain without being able to pinpoint where the pain was at. So for her medications, they were a lidocaine patch, and Subutex for her pain, and others included lactulose for her liver, Lasix, and Visceral for sleep. Moving on to her lab values, her platelets were at 77, which is low, and she also was at a point where her platelets were at 28 before she came to the hospital, or right when she got admitted to the ER. Another lab was the ammonia. She was at 72.2, which is very elevated. Normal is 16 to 53, so obviously she was very elevated. This is a very potential cause of why she went to the ICU when she was unconscious. Another lab was her AST and ALT levels. The AST was at 40, which is on the higher side of normal, and ALT was at 22, which is within normal limits. Moving on to her physical assessment findings was that she had an increase in abdominal girth and weight, many bruises on her arms and legs and abdomen, needle pokes in her antecubital spaces on her arms, and she also just looked kind of dirty, like she had not showered for a few days, and her scent was a very strong odor. Briefly touched on the diagnostic tests, talking about her background, so now I'm going to move on to her nursing diagnoses. First one was alteration in comfort related to cirrhosis, as evidenced by a patient stating pain was a 7 using the 0 to 10 scale, and the patient was visibly in pain. Second one was potential for fetal compromise related to drug and alcohol use, as evidenced by Category 1 fetal heart tones. And the third nursing diagnosis was risk for impaired parenting related to lack of knowledge about parenting skills. Moving on to planning with the patient included finding her a rehab to help wean off the drugs and alcohol, encourage a low sodium and low fluid diet, decreasing her pain severity by reaching a tolerable pain level for the patient, and help provide support and resources for the patient in regards to treatment and child services. So ways that we implemented some of the nursing diagnoses and interventions for them for her alteration in comfort was continuous pain monitoring and administering her pain medications, as well as using alternative therapies such as guided imagery, massage, or aromatherapy. For the psychosocial diagnoses, contacting child services to help support the patient and the state's decision that she was not going to be able to have custody of her child, so giving her resources to help get her through that. and also for her ascites, just providing foods that are low for her body's nutritional requirements, like lower her fluid intake and sodium intake, avoiding alcohol and drugs, reducing factors leading to the temptation of drug ingestion, such as not allowing her significant other to visit, because he would actually bring in drugs and then she would just kind of use them and get back to square one. So, for evaluation, it was not able to be performed on the patient because of the shift change, but when the interventions were complete, the following would be evaluated to measure the effectiveness of them, and they include continually monitoring her ALT and AST levels, continuously monitoring the baby in utero and afterwards for adjustment to no drugs or alcohol being ingested, and providing opportunities for the parents to express concerns or ask any questions. Thank you for listening.